Welcome to our high-yield explainer on toxic shock syndrome. Now, if you're studying for your exams, this is going to give you exactly what you need to know, and more importantly, in a way that'll actually stick. All right, let's just dive right in. We'll start with the story of how TSS even came on the scene. Then we'll get into the nitty-gritty of its attack mechanism. After that, we'll cover how to spot it, tell the two main types apart, nail down the treatment, and wrap up with prevention and prognosis. It's a really logical way to tackle a complex topic. First up, let's talk history. Because, to really get a grip on TSS, you have to understand the moment it just exploded into the public's mind as this terrifying medical mystery. The story of TSS is pretty incredible. It's like something out of a public health detective novel. So it was first described way back in 1978, but it really hit the headlines in 1980. The CDC suddenly saw this massive spike in cases and traced it back to a new kind of super absorbent tampon. It caused this huge public panic and forced some major changes in those products. And listen, this isn't just some historical footnote. The basic risk factor, it hasn't gone away. In fact, we've now seen documented cases with modern products like menstrual cups. This just goes to show you that while the products might change, that underlying bacterial mechanism is still a threat we have to take seriously. Okay, so we've got the history down, but how? How does a pretty standard bacterial infection cause such an absolutely devastating multi-system meltdown? What's the weapon these bacteria are using?
The weapon is a really special kind of toxin called a superantigen. The best way to think about it is like a master key. It completely bypasses all the normal specific locks of your immune system and just throws all the doors wide open at the exact same time.
Now, for your exams, you gotta know the two main players here. You've got Staphylococcus aureus, which produces the infamous toxic shock syndrome toxin 1, or just TSST1, and then you have Streptococcus pyogenes, which makes a whole group of toxins called streptococcal pyrogenic exotoxins, especially SPEA and SPEC. So here's the absolute key difference and why this is so dangerous. A normal antigen, it has to be processed, checked, and carefully presented. A superantigen just throws all those rules out the window. It acts like this illegal bridge, locking an antigen-presenting cell directly onto a T cell, forcing it to activate without any of the body's normal safety checks. It's a total short circuit. At the scale of this activation, it's just mind-boggling. Our normal immune response might activate, 0.01% of your T cells? A superantigen can light up to 20% of your entire T cell army, all at once. That's an insane number. And when you get this massive, totally uncontrolled T cell activation, it unleashes a tidal wave of inflammatory molecules called cytokines. This is that infamous cytokine storm you hear about. It's this storm that leads to widespread leaky capillaries, a catastrophic drop in blood pressure, shock, and, you guessed it, multi-organ failure. So with that kind of violent storm raging inside the body, what are the clues we need to look for on the outside? How do you actually spot this thing when a patient comes into the emergency department? Okay, for your exams, you absolutely positively have to know the CDC case definition. It breaks the whole diagnosis down into 5 really clear pillars. You need a high fever, profound hypotension, that classic sunburn-like rash, and then later on, peeling of the skin, especially on the palms and soles. The final piece of the puzzle is proof that at least 3 different organ systems are taking a hit. And to make that even easier to lock into your brain, just use the mnemonic FHRDM. I like to think of it as, for high-yield recall, don't miss these 5 cardinal features: fever, hypotension, rash, desquamation, and multi-system involvement. Got it? All right, so now we can spot this syndrome. But here's the next step. We have to be able to tell the 2 main bacterial causes apart because, as we're about to see, their clinical picture and, more importantly, their prognosis can be wildly different. This table right here, this is pure gold for your exams. Look at the key differences. Staph TSS usually comes from a localized source, like a tampon, and having bacteria in the blood is actually pretty rare. Strep TSS, on the other hand, almost always comes from a deep invasive infection. Think necrotizing fasciitis, so bacteremia is super common. And then, look at that last line. The difference in mortality is it's stark. When you're faced with this, it's a true medical emergency. Time is absolutely critical. Your treatment strategy has to be fast, it has to be aggressive, and it has to attack the problem from a bunch of different angles all at once. So management really rests on 3 pillars. First, aggressive supportive care. You pour in the fluids, you start vasopressors, and you support any organs that are starting to fail. Second, source control. You have to find that bacterial factory and shut it down, period. That means taking out the tampon, draining an abscess, or surgically cleaning out infected tissue. And third, you've got to be smart about your antibiotics. Now, listen up because this is the most important part of the antibiotic strategy, and it's a favorite exam question. You're going to use a bactericidal agent like vancomycin to kill the bacteria, sure, but you must also add clindamycin. Why? Because clindamycin is a protein synthesis inhibitor. It literally gets inside the bacteria and shuts down the ribosomes, the machinery that's pumping out all those superantigen toxins. You're not just killing the bug, you're turning off the toxin factory. That's how you stop the cytokine storm. Finally, let's talk about what happens after that acute phase is over. What's the outlook for survivors? And more importantly, how do we keep this from happening in the first place? Prevention is really all about common sense hygiene. For menstrual TSS, it boils down to changing tampons frequently, using the lowest absorbency you need, and just good old-fashioned hand hygiene. For the non-menstrual cases, it's simply about good wound care. These simple steps are incredibly effective. But even with the best modern ICU care, the prognosis is just dramatically different between the two. Mortality for staphylococcal TSS is down around 5%, but streptococcal TSS, it's still terrifyingly lethal, with mortality rates often going over 30% and sometimes as high as 50%. It's just a much, much more aggressive disease. And for the people who do survive, the journey isn't always over. That initial multi-organ insult can leave behind lasting damage. In fact, studies show that survivors, especially from strep TSS, face a higher risk of being rehospitalized for kidney, heart, and liver problems for years after the initial illness. And that leaves us with a final thought. Toxic shock syndrome is this stark, powerful reminder of how a system that's designed to protect us, our own immune response, can be hijacked and turned into this devastating weapon of self-destruction. It really makes you appreciate the incredibly delicate balance that's required to keep us healthy.